Hi, I'm Kelly Vaughn, and this is Inside Indy. And the cooler, colder weather is fast approaching, and usually when it's colder, it gets cloudy outside and a little dreary, and it's easy to get depressed. But it doesn't have to be that way, and we have some help in the studio to help us through what some of us may be affected by seasonal affective disorder and more. She is Tonia Richards. You are a licensed therapist here in Indiana, and you have a couple of specialties, right?
Yes.
Okay.
Yeah, I'm a licensed mental health counselor and a licensed clinical addictions counselor here in Indiana.
Wow, welcome to Inside Indy.
Thank you. I'm glad to be here.
Oh, wow, depression. Whew, it's real.
It is.
Explain to our viewers what depression is, what it looks like.
Yeah, so depression is real, and a lot of times individuals, they ask that question. It's a medical model. So we want to look at depression as that it is a brain disease. And sometimes people will say, oh, just smile, get over it. It's okay, you're gonna be fine. Or cheer up, turn the frown upside down kind of motto. And it's not that easy sometimes. It is a lot of times a chemical imbalance in the brain. So we have norepinephrine, serotonin, and dopamine in our brain, and it's an imbalance. And as you said, as winter approaches, we have what we call, and it is a clinical diagnosis of seasonal affect disorder. And it can be just that, the sun gives us natural vitamin D, and it can actually deplete some of those serotonin chemicals in our brain. And so that lends to have a depletion, and so we will get into even a greater state of depression and less,
Really? Okay.
less chemicals in the brain. So it can actually make it more of a depressive state.
So you're saying we're deficient on vitamin D to begin with because we live in the northern hemisphere, but when the winter comes, that we're seeing an increase of that.
Yes.
Okay.
Yeah.
Is it as simple as taking a vitamin D supplement? Does it help at all?
That could actually help, yes, but sometimes it's not enough. So there are other modalities that you can use a lot of times. And if we have depression, along the lines of that too, it can be genetic also. Some people struggle with depression without, having seasonal affect disorder. It could be, this is a mental health disorder as well. So this is something that people struggle with. You would have to, just like you would have somebody who's diagnosed with hypertension or diabetes, we would be diagnosed with depression. And so that would be something, be chronic. They have different types of depression too. Some people have situational depression. It would be something that may not be a chemical imbalance. It may be something that's going on in their life. That would be something that maybe you have a lot of different stressors going on in your life, and it's just something that is overwhelming, and just before this time period or in your life, you wouldn't need to have something like a medication management, or it's not a depletion of chemicals in your brain. It's just something that's going on.
It's situational, what's going on in your life at that time. And I think that's where we confuse the issue. And then when we see someone like Robin Williams, the comedian, commit suicide, we're assuming that the first thing people will say oftentimes in the press, Tonia, is they'll say, wow, it just shows that all that money, can't make you happy, and as if the money had something to do with it, or the lack of money has something to do with it. And then I think, well, the person could have been poor and still committed suicide because it's not about their situation or the money.
Right, yeah, because we always think that, that's where Robin Williams could have had diabetes, he could have had cancer, we could absolutely have depression, because it's not about, you're right, it's not about, turn the frown upside down. It's not about external things or circumstances making us happy or not happy. Definitely that's a great example.
Let me ask you this, because you said something very interesting there. You mentioned the cancer patients, and which is, again, is another, they may not be depressed, but being diagnosed with a disease that could be life-threatening, people don't talk about that part of it.
Yeah. So that's one of the things with my field. I absolutely advocate, and I love the people in our field, and we're doing such a great job. We are really advocating to reduce the stigma to seek and get treatment for mental health. And, we really do a great job here in wanting to have individuals understand that it is something that we are allowed to seek and get help for, schizophrenia, bipolar disorder, anxiety disorders, depression disorders. All of these things are of the brain, and so it is an organ in our body. And so it just like any other, like cancer, you would go to the doctor and you would get, medication, and you would get help. You would change lifestyle behaviors. These are also things that you would do for all of these types of diagnoses as well.
So if the diagnosis is situational versus a disorder, do you treat those differently?
Yeah, absolutely. So if you have a situational depression, so say that you are going through maybe a divorce and there's some stressors around that, and so that causes some, situational depression.
Oh, it's be devastating. It's
Yeah,
it's really
absolutely.
a death is what it is.
Absolutely. It's a loss of something. And so maybe you would seek some counseling for that. You would go to a therapist and you would, work through that, get some input on how to navigate that change in your life, getting through that stressor in your life. That may not be a chemical imbalance. That just is a change in your life. And so you would go to someone and help get that,
To talk about
yeah,
it is a
get
part of
some
the
change.
healing.
Yeah, absolutely. But that doesn't mean we need medication necessarily. Versus, clinical depression, something that I can't get through this. I can't, this is more chronic. This isn't something that's going to go away. It lasts longer than 2 weeks. I can't get out of bed. I'm crying frequently. I have a lack of drive to go, and it's getting in the way of functioning in life. I'm not able to go to work. I'm not tending to myself. I'm not taking care of my body. I'm not cleansing myself. I'm not, it's very, very different in definition. And so that would look like going and talking to a therapist, pairing that up with medication management, seeing a psychiatrist as well as a therapist, and working in tandem with that. So I think those are very differently defined. And so that is something that we really, really advocate in making sure that we look at. It's a different.
Wow. In the cases of those celebrities who we have lost in a suicidal situation, first of all, when you see that national story about Robin Williams, and I can't think of the gentleman who was a chef, had a television show, I can't think of his name, who passed away. What do you think when, as an expert in this area, and when you see a situation like that, do you go, I know exactly what's going on, and could they have been saved?
So that's something that's very actually near and dear to me, because I actually lost my father to suicide. So not only as a professional, but as a person who has lost a loved one to suicide, and as a crisis therapist, I also work at Community North Crisis, and owning a private practice, working in this field. We take that extraordinarily with a very grave. We take it very seriously, and we encourage others to take it very seriously too. And we are very much advocates to help others understand that when someone expresses, thoughts of suicide, to take them seriously, have open discussion, very much stay with that person and talk to them and seek safety. There's many different things, and there's a lot of help out there to help people who are at that place. That is a place of desperation. Really, there's a lot of resources there. You can call crisis lines. There's a lot of different things that we can do.
When we come back, we're going to wrap up this discussion on depression, and then we're going to talk about domestic violence, because October is Domestic Violence Awareness Month, and really every month is October, November, okay?
All right,
when
thank
we
you.
come back. And we're back here on Inside Indy and continuing our discussion with Tonia Richards, who is a licensed therapist who specializes in...
I specialize in mental health,
Okay.
counseling, and addiction.
And addiction, and addiction. And so we were talking about what to do when is the time, and who do we call, when that person needs intervention, needs help. When is the time to do that? Because I think sometimes there's probably a fine line, like, I need to call to get help, but you're afraid to. Or you're afraid they won't come out because there's no police for a mental, I don't even know. See, we don't even know what to call it.
Yeah.
Because our society just kind of brushes right over this thing.
I'm glad you bring that up. So, I mean, it is kind of hard to know. So if you're at a place where you're with somebody and they're expressing thoughts to hurt or harm themselves or someone else, then you can call the police. You can call 911. Do not hesitate if you feel unsafe at any point in time. And you can call and ask for what they call a CIT officer. That's kind of where we were at when we left for a break. And that CIT officer is a specially trained officer, crisis intervention team officer, that can intervene at that time. And they know when they arrive on scene, they ask the special questions. They ask, are you feeling like you want to harm yourself? Do you have access to a weapon? Do you have a weapon? Do you feel safe at this time? Are you wanting to hurt or harm anyone else? I mean, they know these questions and they know how to navigate that care. Can they safety plan on scene? Is there someone that can help them with that? Or do they need to take them to a crisis center or an ER? Are they intoxicated? Are they at that point having psychotic symptoms? Are they hallucinating or delusional? Or are they under any influence of a drug? So they would help that. Or do they need to go to jail? They would differentiate between those things. They know the difference between a mental health crisis or if it's a criminal crisis. So they know and can help. And so if you do not play that role, they have that role. And even if they have a question on the scene, they know to call a crisis center and talk to a mental health crisis therapist counselor at that time. And they also call in their resources. So don't play. You don't have to be scared and don't have to worry. The good thing is also if that person that they're calling you're worried about, they ask for them to help navigate the care with them. So would you like to go to the hospital? Would you like to come with us? And they want them to they want them to go with them voluntarily. If the person is gravely disabled or they're saying no, they want it in their life, or no, I'm not going with you, and they feel scared for that person, they will put them what they call an immediate detention in place. That is against the person's will. It is a 24-hour hold, but it is to save their life. And so we would rather save a person's life, and so would the officers, and so would that person who called 911, I'm sure. So that's when you intervene.
Okay, good. That's good to know. And thank you so much, because again, I think that's one thing we lack in our society is discussing the realities of mental illness, and there's just not enough being said about that.
Yeah.
So thanks for clarifying.
Yeah, I'm so glad you had us here to do it.
Yeah. Domestic violence.
Yes.
Okay. October is Domestic Violence Awareness Month, and make us aware what it is, what it looks like, what it feels like.
Yeah, for so many of us, I think that domestic violence touches us in so many ways. We don't even all want to share it or talk about it, and it's a taboo topic as well. And so here we are talking about these things, and thank you again for having us here to talk about these things. Domestic violence takes on so many different forms. I think that we're so silent in it, and so many people are silent in it. Both women and men and children are exposed. There is no one person. It takes on forms that are emotional, verbal and physical. A lot of them that aren't talked about are the emotional and the verbal abuse. And so we kind of forget about those, don't we? Mm-hmm. When we think about domestic violence, we think about oh my goodness, they're physically assaulting somebody, and that's when, that's the worst violence ever. Yeah. But it's not just that. That's
because sticks and stones may break my bones, but words will never harm me. And we've been trained to think that you can say just about anything you want to, and that's okay.
Yeah, we tend to forget about those words that are weapons, right? But they are, and we're not perfect creatures, are we? We're all flawed and we're human, and we do this, and it's not intentional nor purposeful, but it's when it's consistent and constant, and it's done maliciously and to manipulate and to put someone in a place of controlled, right? And so that's where it becomes abusive.
And in your treating patients, what are some things that will make us understand what that sounds like or looks like or feels like? Give us some examples.
So essentially what happens with domestic violence is it's when a person is at a place where they are fearful for their life, they're not able to function. It gets in the way of them being able to be their own person, and they're fearful to do that. So sometimes individuals will express that they're not able to hold a job, or they're not able to do the things they normally would do on their own accord because someone is keeping them or preventing them from doing that. I watched a little video the other day of someone that had taken their pet to a vet clinic, and they took them with a loved one, well, with an actual abuser actually, and it was in the pet didn't even have a, it was on, I think it was a Facebook thing actually, and the pet wasn't sick at all, and the only reason why she had gone to this pet clinic was because it was her only way to get an escape from this.
Oh, I saw that.
Yeah.
Yes.
It was actually great representation of someone trying to escape a domestic violence.
He had a gun on him.
Yes, ma'am.
And she wrote a note to the people in the office and like, don't say anything, but he has a gun and he's holding me hostage, and now we're here like we're just getting something for the dog. And so they are in a room and she's sitting there, and then the cops just walk in, which I was wondering how they were going to rescue her, because I didn't know he didn't know they were coming, but you still were. They walked right in like, hey guy, give me the gun.
Yep.
Wow, yeah, she was
That's
pretty
how she
distraught.
got out of the domestic abuse, yes, yeah. And sometimes it takes something like that for them to actually get away from a perpetrator.
Why is he doing that?
So that's hard to say sometimes. It could be something that they've grown up witnessing themselves, and it becomes a normality in their life. It could be something of an insecurity position in themselves, so they have to they want to feel superior, and because they're insecure, they want to feel secure in their relationship, and so they have to have someone underneath that. I mean, it's a lot of different individual reasons sometimes. There's a lot of research around that, though.
Okay. Wow. Let's get to the physical part. Physical abuse. What's that look like in terms of the people who you have served? And obviously we're not saying names or anything. We're just kind of generalities in terms of what do you run into? What are you seeing these days?
So there's a lot of different things. A lot of things that I think the biggest thing I would love to get across is that with clients that I've seen and the others, and I know colleagues of mine have seen, is that they come in and they're at places of sometimes they don't see that as being what, you and I have not maybe been abused before, right? So they don't see it as wrong sometimes. So we have to meet them where they are. We can't go in and say, you really understand this is not okay, right? You have a black eye. They may not see that as what you and I see it as. So to share with them.
What do they see it as?
Well, so they're in a cycle of abuse, and so you kind of have to have them share with you where they feel it's wrong or not wrong.
Okay.
And so sometimes just being with them, hearing them, know and see where they feel it's wrong at is all you can really do, and help them get to a place. If they're ready to leave, then be with them and guide them through that. and hopefully they can get to that state. And sometimes that's really hard for loved ones to understand and hear because they want them to leave. They know they're in an abusive relationship, but they may not be ready to leave yet, and that's really hard for them to understand.
Wow. I think, and what about those who are experiencing that and they are calling for help, and then when you say he's on his way over here and they won't come unless they've done something, which is the craziest thing in terms of the law.
And I think that's where then you can also call, officers, and you can help them navigate. And then I love the fact that there are times where the state intervenes and steps in, and there's protective orders put in place, and that's something that we do have in our state.
Okay, but you're referring to the CIT team that they can be called in. See, again, we were not aware of that. So what advice would you give viewers, and I guess those who are around those who we know are being victimized? And we have just about a minute left.
Yeah. What advice can I give? Absolutely be there for them. Absolutely do not turn away from them. When someone is being abused, more times than not, the perpetrator will isolate that victim intentionally and on purpose to keep them away from a support network. And so that is the one thing you need to understand, and that is very important, that they continue to have a support network, and that just be there for them. Just know that they're going to need you in a time where you may not realize that.
Okay. Well, we appreciate you coming in and increasing our awareness.
Yes,
and
I'm so
empowering
glad.
us and all of the above.
Yeah.
Tonia Richards, thanks so much for joining us.
Thank you so much. All right.
On Inside Indy. And thank you for watching. Watch us next time, a week from now, same time, same station.
Yeah.
We'll see you next time. Bye-bye.
Bye.
It's National Fire Prevention Week here on Inside Indy, and this year's theme, Look, Listen, Learn. Be aware, fire can happen anywhere, aims to educate about essential steps to reduce the likelihood of having a fire and how to escape safely in the event of a fire. Joining us today with important fire safety tips is Lisa Braxton, Public Education Manager for the National Fire Protection Association. Hello, Lisa.
Hi, Kelly. How are you doing?
Tell me, why did you choose Be Aware, Fire Can Happen Anywhere as your theme this year?
We chose that theme because homes are not built like they used to be. They use modern construction that often has synthetic fibers. And if that catches on fire, that can cause a fire that can move fast and produces hot, toxic smoke that makes it hard to breathe. We tell people these days that you could have under 2 minutes to escape safely once your smoke alarm sounds. For many of us, home is our sanctuary. It's our safe place to be. We couldn't imagine having a fire in our homes, but that's actually the place of highest risk of fire. That's why we say, look, listen, learn. Be aware, fire can happen anywhere. Look for places fire can start. Listen for the sound of the smoke alarm, and learn 2 ways out of every room.
What do you suggest viewers do to reduce fire hazards in the home?
We advise that people become detectives of their own house. Inspect your home for fire hazards. Look at your kitchen, for instance. Look at your stovetop. Make sure that you don't have anything that can burn on your stovetop. Any packaging from food, the pot holders. When you're cooking, make sure that you're not wearing loose sleeves that could catch onto the burner. Sometimes curtains can be too long and too close to the burners. Make sure that those things are away from your stove. And also, there are a number of individuals who enjoy the candles. They smell nice, they add ambiance to the home, but they can be a fire hazard. Consider using the battery-operated candles that can smell and look like real candles. And also, check the appliances. There are times when, after a while, the cords on appliances become frayed. That can be an issue. We don't want to have electrical fires because of the cords becoming frayed. Make sure they're not running underneath furniture or under the wheels of a chair that's moving and that sort of thing. And if you have anybody in the household who smokes, make sure they smoke outside using a deep dish ashtray and put the cigarette butts out using water in a pan, in a pot, or using sand. So those are ways you can go around your house and inspect and be your own detective and your own advocate for safety around your home.
What are the essential 3 L's of fire prevention and safety?
Look, listen, learn, be aware. Fire can happen anywhere. Look for places fire can start. Listen for the sound of the smoke alarm and learn 2 ways out of every room.
Lisa, what is the first thing one should do to escape a home fire?
Well, the first thing is to plan before a fire takes place. You want to go ahead and plan that so you're not having to frantically think in a crisis what you're going to do. So we tell people to plan your escape plan. Go ahead and draw a map of your home, showing all the doors and windows, all the rooms, put arrows for the exits, and mark your safe meeting place outdoors. Then have a test, do a fire drill like we have school fire drills, do a home fire drill. Go ahead and have somebody hit the test button on the smoke alarm. Then everybody knows what it sounds like once they've heard that, and then everyone should walk outside to the safe meeting place and not go back inside. And if there's a real emergency, call 911 from your cell phone or from a neighbor's phone.
Is there a website you can refer our viewers to where they can get more information?
Yes, firepreventionweek.org has all kinds of great information you can use to download apps. There are videos, safety tip sheets. Our main website is nfpa.org, and that has all that information as well.
Thank you so much, Lisa, for those fire tips.
Thank you.